We have a long history of heart disease in my family. My father passed away when he was 46 with a heart attack. I know I have a family history of heart disease, so I tried to stay in pretty good shape. About 8 years ago, I woke up at 6 o'clock in the morning, got ready to go to work, and at 7 o'clock I was just about ready to leave for work, and that's when, I had the sensation that I was very sick, and by 7:15 I was at the hospital.
I just remember feeling shocked and just thinking about my dad's dad who had a heart attack and passed away when he was a similar age to my father.
Within 10 or 15 minutes of getting in the hospital, I was in the back room. They gave me an EKG, and they could tell immediately by the EKG that I was having a heart attack. I was right in the middle of having a heart attack.
We performed a cardiac catheterization on him, and that actually showed that the artery that was causing his heart attack was 95% blocked, and we were able to successfully treat it with a stent.
I immediately recognized that he looked a lot better, and he looked like more of himself again, and he was in a great mood, and it was great to see.
When David came back to the office in follow-up, I could tell that his whole life had changed. He felt as if he had more energy than he had previously.
I attended a cardiac rehab, and I returned to jogging and kayaking and hiking and spending more time with my family and getting back to a normal routine and enjoying myself with them. About 3 years after my heart attack, I had another situation where I had chest pains.
And it just sort of came out of nowhere, kind of like the other one.
We found that the original stent put in 3 years earlier looked fine, but he developed 2 new blockages in 2 different arteries of 90% each. Since the technology had progressed to the point that we had stents available which had a drug coating reducing the risk of restenosis, in this case the Taxus stent, we decided to go ahead and place that in each of the 2 blockages in the 2 arteries.
The second time that I went in, I felt a little bit more relaxed. I knew that the last time it was a good outcome, and I had confidence.
After the second procedure, Dave did terrific. He did terrific from a physical standpoint. He was back to his baseline level of function, baseline level of activity, was able to do whatever he wanted to do, free of chest pain, free of shortness of breath.
Now that I have the 3 stents in me, I think I look at life a little bit differently. I appreciate life more. I look at it as a great opportunity and for extra time with my family.
Today, my dad is as happy as he's ever been. He's surrounded by people he loves, and he's always very active, and he's living a great life. My dad's very fortunate to have a job where he contributes to a team that helps people in a very real way.
When you have a Boston Scientific stent inside you, I think it's natural that you want to go and work and help the company and keep making high-quality products.
Quality is important to me because the use of a quality product has allowed me to spend more time with my father and has given him a second chance at life.
The basic expectation for any person, any patient, is that the product that's being put into their body is the best.
I know that every day, if there's any question about patient safety, the quality of the product, that we always make the decision to scrap the product, and nothing proceeds unless it's the highest quality product that we can produce. I'm happy to work at a company like that.
I want to say thank you, thank you, thank you to the Boston Scientific employees for the tremendous work that they're doing, the work that allows us as physicians to have confidence in terrific products, and for the work that gives confidence to the patients for having terrific products placed in them.
Without Boston Scientific, I might be without a father today, which would be the same position that my father found himself in when he was only 8 years old. I'd like to say thank you to the employees of Boston Scientific from the bottom of my heart, because you've afforded my father the opportunity to have a second chance at life and given me the opportunity to have him there for me, as he always has been and he will continue to be.
The most important things in life are my family and my friends, and being able to spend time with them and being able to provide for my family. Going through all of this and having the Boston Scientific stents, it allows me to continue to do that, and I'm very grateful for that. Thank you for manufacturing a perfect product that's going to be in me the rest of my life.